The Children's Health Insurance Plan had expired under the Bush administration. The authorization expired in 2006, if I'm remembering right. And so for 2 years, the program was unauthorized. And that was not good for children. And actually, the first bill that was passed by the new Congress in 2009 was the reauthorization of CHIP. Which actually turned out to be important to my placement when I got here. And the intent in the Obama administration was to reinforce it and kind of remake it what it was, the think tank for health and human services. And I was really interested in that process. How do you reconstitute an office that had been kind of ignored in the previous administration? I think the thing that attracted them to me was I was a pediatrician and they knew that they had some work on CHIP coming up. So one of my first tasks was to work with them on the evaluation of the CHIP program and writing the proposal for the bid and then reviewing the proposals that came in and then eventually awarding the contract. And we actually did that during my fellowship. I wrote the proposal, I reviewed the stuff that came in, and they actually gave me a 1-month extension in the office so that I could be there when the contract was awarded, which was actually very nice. But then when the Affordable Care Act passed in March, the other thing, and I remember this because I was the junior person there, they handed me the bill, and said, go through and underline all the places that say evaluation and research, because those are ours. There were 500 something of them. There's a lot of them in there. The Affordable Care Act asked us to do things that had never been done before. And so the big questions were, do we need to stand up new divisions? Is there an existing element within HHS that can do that? It was often really interesting to be the doctor in the room when people were talking about all these things. For example, with the Affordable Care Act, for the first time in Medicare, preventive visits were going to be covered. That had never been covered before. And nobody in Medicare had any idea how to bill for that. And I said, well, we've been billing for that in pediatrics for years because we do well child visits. And so I gave them my billing sheet from my practice and said, this is how we bill for preventive care. I happened to be in that room and so could make that connection. I think there were a bunch of little things like that where I discovered that the people who are making policy, most of whom are economists or political science majors, don't actually know how healthcare works. And it's really helpful to them to have a doctor in the room. I think it is really important that we continue to bring in folks with clinical experience because that clinical experience informs policy in ways that you can't possibly imagine.